Good afternoon, everybody. Welcome and thank you for joining today's webinar on advancing the patient experience with the National Association of Counties and our partners at NetSmart. My name is Nastasia Walsh. I am the Associate Program Director for Community Health and Justice at the National Association of Counties, NACo. I'm going to be moderating today's webinar. Before we get started, just a reminder, the session is being recorded. We're going to have the recording available on the NACo website after the event, along with the slides. Please feel free to use the chat box to pose any questions you may have throughout the conversation. We'll be able to address those during the Q&A portion at the very end. We have a really important topic for today's discussion, so I'm glad you were able to join us. As information sharing within our health systems becomes the expectation, so does the advancement of the patient experience. So this begins with the range of interactions patients have with both their providers and the healthcare system as a whole, as well as some of the consumer-driven technology to help boost engagement and collaboration. So with the self-help tools that are proactive and connected, patients become more invested in their care, resulting in better outcomes for everyone involved. But in order for our patients to leverage these tools, the technology has to include three components most important to the consumer. So today, we're going to hear from NetSmart, who's going to review some of these basic building blocks to patient engagement and show how far-reaching they are into all aspects of your organization. So let's go ahead and jump into the discussion. I'm going to turn it over to AJ Peterson, and he has served as the Vice President and General Manager of Care Guidance for NetSmart for 10 years. And in this role, he is maintaining an efficient and client-focused model around connectivity, consumer engagement technologies, virtual care, analytics, population health management, and develops value-based connections among clients and suppliers, partners in the healthcare market. So very excited to have our partners at NetSmart here today. And Mr. Peterson, I'm going to turn it over to you.
All right, thank you, Nastasia, for that great introduction, and want to welcome everyone here to our webinar today. As Nastasia mentioned, it's an interesting time when we look at how patient engagement has become such an important part of healthcare delivery and care coordination, and the really exciting part around how technology tools are available to us today in ways they weren't before in the past. So really excited to have our speakers, our panel here to take us through kind of their journeys and views around patient engagement. But first, I wanted to welcome everyone, all of our NACo members, to the webinar today. Thank you so much for taking time in joining us today for our conversation around advancing the patient experience. And thank you, NACo. We're super excited to be a partner with you and really continuing to work together to strive to continue to advocate for our communities that we serve, whether we're partnering on policy, on legislation, reimbursement, utilizing our national scale and footprint in order to do the best good possible. Also, we're really excited and thankful that we have the opportunity and obligation to support over 600 counties across the nation on our technology and services, solutions and platforms. So, and also really appreciate and value the partnership with the National Association of County Behavioral Health and Developmental Disabilities directors as well. First, want to say thank you and really appreciate all of the fantastic work that counties are doing day in and day out in serving the individuals in your communities and looking at the full breadth of services that are offered across the community, whether we're looking at behavioral health, substance use, IDD, social services, working with housing, working with justice, jail reentry, all of these different critical services that individuals in our community need to have clear and easy access to. And when we look at kind of where healthcare is going and the current climate that we're in, it's so important that we're creating these opportunities or entry points for individuals into the county and allow them to find access to all of the different services that they need. And this is how we've been looking at the no wrong door policy and program, so that when individuals are stepping in and looking for a specific service, and we've identified additional needs that that person may have, that we're able to quickly link them and coordinate care and services across the county. And this is what kind of leads us into our webinar and into our conversation around advancing the patient experience. So what are the strategies? What are the operational and clinical processes? What are the technology tools that are needed in order for us to provide that no wrong door access for an individual, as we look at services that are being delivered and coordinating within the county, but even as we look outside of the county and other provider organizations that have a stakeholder care for the individual, and how are we improving the overall care that's being delivered. So when we talk about the kind of the three pillars, we're really looking at, timely access to care. So how are we timely access to appointments, to accessing services inside the organization? Also, how are we sharing and accessing information on an individual across all the different stakeholders of an individual's care? And then third, we're looking at how do we have really good communication inside of our own county organization across departments, but also how are we communicating with stakeholders like hospitals or primary care or other organizations that may sit outside the county or maybe partners with the county as well. So we're going to kind of walk through some of those different scenarios and how that is being addressed specifically with our distinguished speakers here today. So first, let me introduce. So I'm so excited and pleased to be here today with both Luis Diaz and Grace White to talk about the experience at their organization. So first, with Luis, let me give you a little background. Luis is the centralized record supervisor at Waukesha County Health and Human Services. Luis has worked in healthcare for over 16 years, and over the past 5 years has been at Waukesha County. His current role, he oversees the management of health records, the electronic health records, and ensuring compliance with the various state and federal regulations that govern both mental health as well as substance use, which we know that there's complexities around the sensitivity of that information. In addition to his health information management functions, he also oversees the patient portal and telehealth services for the county. So really diving into the consumer engagements and virtual care. Luis also has a BBA from Marquette University and a bachelor's in health information management from Webster State University, and is also a registered health information administrator. So super excited to have Luis's perspective for the discussion today. And then we also have Grace White from MHMR of Tarrant County. Grace is the Chief Quality Officer at Tarrant County. Our experience is in integrated whole person health and has a vast experience as Chief Nursing Officer of the county that's really driven and informed her delivery of patient experience. Throughout her career, is focused on community mental health and public health, spending most of her time at MHMR at Tarrant. She's also passionate about improving the system of care while developing innovative ways of helping patients wherever they need assistance. So very excited to have both Grace and Luis participate with us today. So what are we going to be covering? Want to give a little bit of the outline of the discussion that we're going to have here today. So we'll start out with Grace telling us a little bit about MHMR Tarrant County and what is has been their approach to patient engagement. And then we'll learn around Luis and Waukesha on their approach and focusing a lot on data on how that is important as it relates to patient engagement. Then we'll have a little bit of an open discussion, and then I'll talk a little bit about at the end around some technology approaches that we're seeing kind of widely adopted across the industry to help us when we think about the three different building blocks or pillars to good patient engagement strategies. And as Nastasia mentioned, for those who have questions throughout the presentation and discussion, please enter them in the Q&A section inside of this webinar, and then we'll try to answer as many of those questions as we can as we move through. So with that, I would like to bring in Grace. And Grace, do you mind giving us a brief overview of who MHMR of Tarrant County is? And then we'll get into some of the dialogue around patient engagement.
Sure. Well, My Health, My Resources, MHMR of Tarrant County. We're in Fort Worth, Texas, which is right next door to Dallas. And so we're in a very large metropolitan area. We are the second largest community mental health center in Texas. There are 39 of them. And so we're the second largest. Last year, we had 68,877 people served, unduplicated. And we had over 120,460 calls to our crisis care hotline. So we're reaching out to a large number of people here in North Texas. We have over 50 sites. We have 18 clinics, but then we have sites that do all sorts of things such as group homes, both inpatient and outpatient services. Our services include mental health, intellectual and developmental disabilities, substance use disorder, child and family services, early childhood intervention, criminal justice support, veterans, and homelessness. And we are a certified community behavioral health center. So we utilize that methodology in all of our actions that we have with our patients. And another thing that I think is important to know for NACo is that MHMR is a local unit of government. And so what that means is that we're not state, federal, or county agency, but a local unit of government.
Awesome. Thank you for that overview. So, you know, when we talk about these three building blocks of patient engagement, one of them is around kind of timely appointments. So can you share a little bit about the approaches that MHMR of Tarrant County has taken as relates to timely appointments for your consumers, patients?
Okay, so one of the big things about being a CCBHC is that we had to actually measure our appointments and make sure they were timely. And the EHR was fantastic with being able to get us to do that. There's no way we could have done that without the EHR. It helped us get our workflows better. And so we were able to be able to track the data that we needed to have and the data analytics that we needed. And it just made it so that we could improve that experience for our patients. What we have is an open access center. And we also, as I was saying in our introduction about MHMR, we have a very large crisis line. And that really is the entry point for most of our patients, that they end up calling the crisis line first. And so the crisis line is going to get all that information and then say, you know, we have open access. If you want to go, I mean, unless it's in the middle of the night, if you want to go today, you can just, here it is, it's right here. You can come on in, you don't have to have an appointment. And so that information is then immediately available in our open access clinic. We also will look to see if we have calls and say maybe it's been a couple of days and the patient hasn't shown up yet, then we do warm handoff calls to actually call them to say, hey, we're here. Would you like to come see us? Is this what's going on with you? So we really try and have that improve for them with that. One of the things that we have at our open access, we call it access to care location, is that if patients need medication immediately, they get to see a prescriber and they can get medication immediately. If they need to be able to have counseling and that sort of thing, we can get that immediately. And so sometimes, especially in our area, it's very hard to get access to clinicians that are able to do all of that sort of thing. The other thing that has really, really helped us is you wouldn't often hear somebody say COVID, but COVID did help us because it got us out of our, I had gone to a conference about telemedicine 2 months before the whole nation shut down. And the things that I wanted to try and do with telemedicine, I believe that we jumped forward 4 years in 2 months because there was no way we were going to be able to do it otherwise. And the things are that we went from using hardly any to having a very quick transition, all of our services suddenly became telemedicine, whether it was physicians, whether it was our qualified mental health specialists, whether it was service coordinators, whoever it was. And so the nice part about that is that with telemedicine, if somebody needs to see a doctor and normally you'd go to a clinic and there might not be any, the doctor might be seeing somebody constantly there. With telemedicine, we can see, okay, they need to see a doctor. There's an opening. Well, we can get you, I mean, you can see somebody that's 50 miles away because it's through telemedicine. So it's really easy to get access to link with them. Another thing that the county did that was really important for us is that many of the patients that we see, they don't have access to computers or smartphones and things like that. So because of COVID, the county gave us, I don't remember the number of tablets that they gave us, but it was a large number of tablets, and as well as hotspots, so that we could give those to our patients and that we could help them learn how to use the tablet and hotspot. But then they had that to be able to do what the work as far as telemedicine, or we even did groups. So we had for people that we have lots of mental health support groups as well as substance use disorder groups. And so we did those virtually and online, and people could do that from their home. If they didn't have that, then we made sure that they got phones so that they were able to log in that way. But I think that being able to have the EHR and being able to utilize that technology, that really helped people see their physicians or see their people that were working with them.
Yeah, I think it's interesting. You know, it's you hear about, you know, previously before COVID, telehealth was kind of limited to, you know, psychiatric care, and where there's a psychiatrist that's in a facility and then the client is in a facility.
Right.
And that was a lot of what telehealth and telemedicine was like. And as the whole turned it on its head and having to play out virtual care services kind of going forward across all different service lines really accelerated those strategies. Just a quick follow-up question, Grace, just your thoughts on it. You know, what in your opinion, has the demand for healthcare from the consumer's perspective changed to where you think telehealth will stay in some form or fashion going forward?
Yeah, I do think telehealth will stay. The thing, and so this is where it's interesting, because staff want telehealth to stay so that they can stay at home and work from home. But the patients, the reality is they would like telehealth to stay so that they don't have to come into a clinic. Many of them don't have transportation, or if you have to get on 3 buses in order to get here, it takes up your whole day. If we're working on them to be able to get a job, it makes it almost impossible because they have to take a whole day off to come see us. This allows them to be able to have their life be enhanced.
Absolutely.
And yeah, they really, I mean, patients, and I will be honest though, some people really like it and some people really don't.
Yeah.
And so if the patients really don't, we are back in business at all of our locations. Not that we ever weren't in business, but we're back in person in business so that they can come in and see us in person.
Yeah, I think that's great. I think that's what I've been hearing as well. When you think about, you know, provider retention, provider satisfaction, and, you know, those that really enjoy telehealth, it's a great way to retain those high valued associates. And then also on the consumer side, we look at social determinants of care, how can those be overcome by the use of telehealth? So that's a great insight. You know, Grace, we did actually
models too, though, if you think about it, because prior to COVID, being able to pay, we had to have it at, the doctor had to be at a location and the patient had to be at an inpatient location because it wasn't going to get paid for otherwise.
That's right. And we just I think a week or two ago, they were the CMS has put it out, the physician fee schedule from the Medicare side around making more of those regulations rolled back at least through the end of 2023 and look at how do we make those actually permanent. So that's awesome. Someone actually has a question already, Grace, in here. So so for the open access, do you have open access at all of your sites or just specific locations?
We have specific locations. Prior to COVID, we had experimented with having it at all of our locations, and frankly, we don't have the staffing to be able to have it at all of our locations right now, because we do have to have somebody there to assist them coming in and getting all of that to work that way. So we just have it at a few right now.
Excellent. Thank you for that. So kind of shifting to the next building block where we talk about the ease of access of information. Can you talk about what that's looked like at MHMR and why that's important?
Okay, well, one of the things that we've been able to do for information access is we utilize care quality, which is utilized throughout the United States. That is something that every single thing that we do with our patients is extremely helpful, because our doctors look at it before they see every patient, so we know exactly what's been going on with them, but we can share it with their providers, because then they're providers in other locations. If it's their primary care physician, if it's their specialist, if it's the hospital, whoever it is can see what is going on with that patient and what those prescriptions were. The thing that makes it challenging for us, particularly here in the Dallas-Fort Worth Metroplex area, we're extremely large. You would think, oh, people would be sharing, like if you're prescribers, you would share it with the health information exchange. We don't have one here. So it's not like it's an option. We have to be able to leverage what all of these electronic means that we can get otherwise. And it's not realistic for patients to remember all of their medications going from person to person, this going from doctor to doctor. It allows them to be able to make sure that they are, that's already there for their doctor to just be able to click and look. We also utilize within our own teams, because we're a large organization. So some of this is we have to share information going back and forth just within our own businesses when we have 50 sites. So part of it is secure direct messaging, which we use the NetSmart product, and that it's Care Connect. And so we're able to share, whether it's referrals or whether it's, whatever it is that we might want to share back and forth. But we're also able to use Care Quality and Care Connect to see what's going on in the patient in the hospitals. One of the things that was most important, being an RN and being in charge of teams of nurses trying to figure out what we're going to do in COVID, we had, I don't even know how many patients that were in the hospital with COVID, but many of them were our group home patients. So we were trying to figure out, okay, what's going on with them? When are they going to be coming back? What do we need to plan for? And through Care Quality, you can see immediately what's been going on in their day. I mean, we have the patient, as long as that patient has shared that it's okay to share that information, we're seeing the team meetings that they have in the hospitals. We're seeing this is their discharge planning piece. Now we're thinking tomorrow this, the next day this, the next day this. And so we're really able to work on making sure that we have the best plan for them coming home. And we're able to do a lot of that electronically versus usually it's always been pick up the phone. One of the things that we have that has been challenging for us, and we're working on how we can make that better, is we haven't done as well with our patient portal, which would be a way to be able to share information best for the patients. For whatever reason, the staff haven't done as well with selling it to patients for them to agree to use it, and then we just haven't utilized it as well. I'm really hoping that within this, we're doing another push right now on re-educating staff on how to get patients signed up and how we can utilize that better. And that would really be something that we can do that will really link to more patient engagement, because then they themselves will be seeing all of that data immediately within the health portal.
Yeah, you touched on some really important points around interoperability and data sharing, and how important it is in near real time to have the updated health information of a person when they're in the hospital or they're in the primary care office on that encounter. And you mentioned one of the areas super important is the medications.
Right.
Being able to go in and pull, for one, find out where did the person get seen, because sometimes I don't know that. And then two, being able to pull that data out of that hospital EHR and then incorporate it into the behavioral health chart is a really important thing. And then going through a reconciliation process of bringing
Yes.
that information in is super important. As a nurse, I would imagine that's extremely important.
Yeah, that's vital. And we do that. I mean, I have staff that do that every single day with care quality and the CCDs to make sure that that's going into our care records so that we can know that. One thing that's also really important about those medications that's helpful for the hospitals to know about all of us that is in the community is we have mental health patients. And so they're on sometimes long-acting antipsychotics. And so if they get an injection of Invega Sustenna 3 days ago, but then the police are bringing them into the hospital and they're getting admitted, that patient's not going to remember that they had that. And unless the hospital has access to know that we just gave that medication to them and that's going to be in their system for several weeks, they could end up having a medication reaction and the hospital won't even know.
Absolutely correct. And that's an important point around how important it is for that to be a bi-directional exchange of health information. But I just say even a step further is that that data is then integrated into the workflow of the provider, because in your instance, if that ER doc or ER nurse had to go and log out to a separate system to be able to look for that information, they probably wouldn't see it, but they would be able to go pull that behavioral health information directly out of the care record and then present it into their Epic or Cerner or whatever EHR that they have in place.
And at least for us, our main hospital that we work with here in Tarrant County is the county hospital. And so it's John Peter Smith, and we are a favorite for them in Epic. So we are the top one that they can go to and link, the very first one that they can link. Now, there's a lot of challenges with that because you also have to, the people at that hospital have to train their providers.
That's right.
That's where you look.
That's exactly right. That's exactly right. This is where the data is going to be. And you talked about the consumer engagement side with the portal, and it's I think the educational piece is one of those really important points. Both educating your staff and providers, but then also educating the consumers around, hey, you having access to your health information is valuable because it brings you into the decision-making process. And we're also allowing you to be able to see and interact with your data, but then also this is the way in which we can communicate securely for you or your family member back to our agency. So I think the educational piece that you talked about is so important in that process. And there was actually a question that came in, Grace. I think it can go to the patient portal, even on the telemedicine side. And wondering what you're doing to make sure consumers have the best telemedicine experience possible by preventing technical difficulties. So you talked about enabling and deploying out iPads and technology. Did your organization put up any kind of internal support for consumers using that technology?
Well, what we did was, because now we have more internal support, but as we were rolling this out, we didn't. So it was all of this thinking on the fly. And so I was like, look, as far as we know, you're going to screen those people and ask them the 3 questions about COVID. If they've got it, you're going to put on full PPE and you're going to go in their house and show them how to do this. And so we sent staff to go and do it. We had no one get COVID from doing that. And you're screening technically you're screening the patients before you go in, so you shouldn't get COVID anyway. So, literally, we did a lot of showing them how to turn it, because people didn't even know how to turn it on and where to go and all that sort of thing. So down to charging it and making sure that they were charging it correctly. So we did. And then we, of course, had to train our staff how to go out and do that sort of thing too.
Yep, got it. So it was very much a hands-on approach,
right?
Educating and supporting the individuals. That makes perfect sense. Okay, so kind of the last piece here is around communication with patients and external providers, and you talked a little bit about that already. But kind of what's been your approach, and what have you seen around the communication as one of the building blocks?
With us, it really is being able to share information with those providers that are out there in the community, and for us being able to get the information back. And so being able to know when somebody's being discharged, and it not only helps us by being able to have that data, but we're able to make sure that we make timely visits to them. One of the things that we have to do as a CCBHC, and it's it's a HEDIS measure. So if somebody has a managed care organization you're working with as well, you're going to have to do 7-day follow-ups on somebody that has been in the hospital or the emergency room. And so it helps us know that this is a person we need to be watching for. This is also a person that we need to do some high touches with. So we have care coordination teams, and we make sure that our care coordination teams know, does the patient, okay, we maybe are going to see them this date, but do they have their medicine? Do we have what's going on with them? How's it going at home? That sort of thing. So we really try, and as long as we can realize that they're going to be discharged, then we can get the supports out there to them. Now, one thing that can be challenging, and it's not always, well, we discussed this at one of our meetings this morning, is that we have a breakdown that is on the Epic side at our children's hospital. And so they have upgraded something recently in Epic, and now we're not able to query. So we're not able to get the information from them. And if they're sending it to us, we're not getting it. And so, and that happens frequently at that children's hospital whenever it updates. And so we're having to make sure, okay, make a plan of how we're going to go, who we're going to talk to, and how we're going to make sure that that really does come through to us. And that's one of the things that sometimes, and even with doctors' offices, if we have our FQHCs use NextGen as their EHR, it requires being able to talk with them about, since we don't have an HIE, what care quality is, because all of them are on care quality. It's just that the staff you're talking to don't realize it.
Yeah, so it's educating themselves on technology and tools that they have available. So I think that is a good point, Grace, in that oftentimes, from my perspective, the hospitals and primary care don't know that these capabilities are available in behavioral.
Yes.
Right. So, the traditional health information exchange was kind of that intermediary, but now the providers are exchanging data directly with one another. So being able to articulate that, hey, so as other counties are listening in, and these tools are available inside of your care record, being able to have those conversations with your partners, like the Children's Hospital, around, I have these capabilities to start sharing data. Let's make sure we have an operational process for it. Right.
Yes.
Awesome. Very good. I think that is great, and I really appreciated that on those anecdotals around how you're using the health information. One other area was a question around, do you have the technical capabilities to do this, and you put it into play, and you're receiving the value? Kind of what was life like before you had these, and especially as you talked about the CCBHC requirement around the timely access after discharge. How were you having to manage that before having an integrated kind of interoperability solution like this?
Reality was to get things from our own crisis line to the access to care, a lot of faxes from our own place, things tracked on Excel spreadsheets. And what's interesting is, even though, because we have been on our on the EHR with NetSmart now for 3 years, sometimes I still find people that have their Excel spreadsheets, and I have to explain to them, no, this really is easier over here. Here we go. But the other piece is for outside providers, for hospitals and for doctors. The doctors' offices, it's challenging because as a behavioral health center, many times they put us last to share information with. So we just wouldn't get it, or we might not get it for days or weeks. And so that's very challenging. And the other thing was, with hospitals, a lot of times it was faxing back and forth. And so especially for transitions of care, it was only as good as if we knew, if no one had quit at that location and we knew who the fax was going to go to. Otherwise, it just went into a dark hole. Yeah,
it's amazing the night and day around the efficiency of previous paper-based manual process to now a fully integrated solution. So I really appreciate you sharing that and giving us all some of the insights into what you guys are up to. So hang on, I'm gonna go and bring Luis in here. So Luis, if you don't mind coming on and really, if you don't mind taking a few minutes to talk a little bit about Waukesha County and who you guys are, or who you serve, and then we'll start talking a little bit about some of your patient engagement strategies. So Luis, do you mind telling us a little bit about Waukesha County?
Sure, no problem. So Waukesha County is located in Wisconsin. We're about 30 miles west of Milwaukee. Very similar to Grace, we offer a lot of the county services. So we have aging services, veteran services. Our biggest areas, clinical, we have a 28-bed inpatient psychiatric hospital. We have an outpatient clinic, and then we also have intensive outpatient programs where we also have contracted group homes that offer the services. I'm probably missing some other areas because we're pretty large. We do a lot of services for the county here as well.
Great, so thank you, Luis. So kind of diving right in, can you share a little bit about, we've been talking about from a patient engagement perspective, we're talking about, how to improve access to appointments, how we're sharing data, how we're communicating with providers. Kind of what's your view of the lens of patient engagement through the lens of Waukesha?
Yeah, so for me, there's 3 big areas that focus on patient engagement. I would say it's communication, it's involvement in treatment planning, and then overall access to information. So as far as communication goes, what Waukesha County has been doing, especially in our clinical area, is using our patient portal. So we have NetSmart, my health point. And so that really provides that two-way communication between the patient, the clients, and the providers, in a timely fashion as well. And then the other piece I mentioned, being involved in treatment planning. So we also practice concurrent documentation. So when our clients are coming in for services with the therapist, they're documenting in a timely, with the patient. And so then the client's able to review the notes, they're able to review the treatment, and they're being involved in the treatment planning. So that's another area where we're involving the patient. And then lastly, access to information. So our new thing that we're approaching now is having our clients sign up, when they come in for a walk-in clinic or open access. So we're having tablets being available to them so they can enroll in the patient portal. And so they're involved with their treatment from the start and continuing as they're continue to receive services. So overall, we really do focus on getting our clients enrolled in our patient portal so that they have that communication, so they have those appointment reminders, and that just keeps them involved in their services that they're getting provided.
So the kind of question that came in earlier around the support that you provide, and Grace was talking about, really educating the staff and providers on why using the patient portal is important. Kind of what has been your approach at Waukesha on how to educate and get the staff on board that this is a good thing?
Yeah, so I think it's multifaceted. So I think it starts with, the admission, we call them the admission staff. So it's the front staff that you really have to get them involved, and they have to really understand the value of what, our patient portal is really going to do. So rather than, staff receiving phone calls, this now translates to direct messaging with their provider. And so now we're having to fuel less calls at the front desk. So that's getting that buy-in from the staff that are going to be doing the enrollment. From the provider side, with our nurses, it's also similar. We're going to be able to provide some of those services, those questions that you may have, and we're going to do that in a different fashion. So we're going to do that through messaging. We're going to be able to refill your prescriptions more timely because we have this, technology that will allow us to do that. So that's kind of been part of the campaign. It is very, we also struggled with getting patients enrolled, but we keep trying, and we have different attempts to do it. Our most recent one, obviously, like Ray said, COVID helped. We needed to get our consent signed. We need to get our clients connected to us, and so our enrollment for the patient portal really, grew through COVID. But currently, we have one specific staff that actually helps our clients that struggles to when they struggle to actually enroll. And so we have a kiosk set up so that they can walk in there, they can help the client enroll for the patient portal.
Yeah, that's great. I've heard that success around direct engagement to educate individuals on the value, because if you're going to ask them to do something, there needs to be a return and a value. And the way to, and when organizations like Waukesha are saying that this is the improved or most efficient way of you communicating with us, that we can get back to you as quickly as possible, as well as some of the added values around the appointment notification reminders, the instant the messaging that you're talking about, and then being able to capture certain clinical documentation, as well as giving them access, giving individuals access to their healthcare information. I love how you kind of tied that back to improving the overall quality of care when a consumer is more invested in their care. One of the ways you do that is by empowering them. And it's great to see how you guys are doing that with the use of the tool such as the patient portal. So fantastic. So thinking about, kind of shifting a little bit to the role that data plays. I know you're a data person. So, how do you look at data and the importance of it as it relates to patient engagement, probably more along the lines around the kind of the access and the sharing of information with external providers, but then also how you're leveraging data in order to drive decision making. Do you mind sharing a little bit about that?
Sure, yeah. So we, we're pretty big into data. I'd say we utilize a lot of dashboards. And so part of it is we utilize dashboards to determine appropriate staffing needs. And mostly for our crisis services and our inpatient hospital. So those are the two areas that we want to provide appropriate staffing for critical care needs in those areas. But in addition to that, we also utilize it for other areas. So I talked about the walk-in clinic. We want to make sure that we're able to have access to those clients that need it on the same day. And also for telehealth services, we want to be able to provide those services. And in order for us to do that, we have to be mindful of, utilization of those services as well. So that's one way that we utilize dashboards. The other piece is more for reporting and compliance, right? So we utilize dashboards to make sure that clients are being engaged in their services. So we have reports that come out that say this client has not been seen in 3 months. Well, now it's time for us to follow up and make sure that they're still going to continue to see us. We also have reports that or windows of information that say this client has not signed their consent. So now it's time for us to make sure that they're compliant and that we, help them be compliant with those consents. Same thing goes with prescriptions. If they run out of prescriptions, then we are also using that information to make sure that we're refilling their medication. So just overall, we have a lot of dashboards, reports, windows of information that we utilize to make sure that the client is, continue to be active in their services that we provide.
No, that's fantastic. And, as hearing you talk through that, you're looking at data as a way to be more proactive with care. And, you talk about compliance, but it sounds a lot like you're doing, a little bit of kind of health status monitoring. So there's certain criteria that you've established around kind of a care guideline, if you will, as far as engagement with appointments, with medication. You've got consents and other types of documentation, and more proactively reaching out to the individual rather than an event driving an engagement. So do you think about patient engagement as more of a proactive management or proactive care tool?
Yeah, I would definitely say that, the focus has to be the client and anything that we can do for them to continue to be involved in services, and, giving them those appointment reminders, having our staff get those flags that will bring them in, so that, like you said, we want to make sure that our patient clients our patients that are receiving outpatient services, they're able to continue to do that and that they're successful and there's good outcomes so that they don't come back to us as an inpatient, right? So overall, it is about being actively engaged with them.
So what would you say the next turn in kind of patient engagement would need to look like from someone who's really focused in on data? What are some of the next projects or things that have you kind of excited around opportunities and possibilities of?
I think I'll speak to Waukesha County. I think we're really excited about the information sharing aspect, right? We're joining care quality. And so that aspect of being able to share that information, now we have information that we may not have had before, but now we can use those records. We can use that information to, continue to service our clients. So I think that's the next piece that we're excited about here at Waukesha County. And I think it's really going to help us serve our clients a little bit better.
Yeah, I agree. The ability to share data and be able to aggregate that and action that data is really, really powerful. So I'm excited for you on the possibilities of what's next from the access and sharing of data. So that's great. Thank you so much, Louise. So Grace, if I can kind of bring you back in to the conversation and even kind of piggybacking on what Louise just mentioned, as MHMR of Tarrant County have been utilizing some of these access to data and sharing data tools. The reason why we do this is the patient and the person in the middle. So can you share some stories or some feedback that you've received from staff around how patient engagement initiatives are really impacting them?
Sure. Well, one of the things I had actually reached out to some of the people that worked for me prior to this, and I had one of our nurses, she just sent me this long list. So I'll just read you part because all of these are awesome. And so she actually works in our youth area. So everybody that she works with is 18 and under. So she said, we have a 15-year-old young lady who's receiving behavioral health center services at the youth clinic, and she recently had a baby. So the practitioner, the prescriber that we have there, referred the patient to the RN care coordinator due to low weight and concerns about birth control. So this young lady's mother only spoke Spanish. So we had being able to talk with both the mother and then the patient actually spoke English. So this staff person used the language line to be able to do the translation back and forth. And from talking with the mother as well as the patient, she found out that she was not being able to have access to birth control, and that for some reason they're like the physician's not giving me, allowing me to have birth control. So the staff person called the physician and was able to find out that what they needed was authorization from the insurance. So we had the information to give the insurance and share that with them so that they would be able to, the doctor's office could get that and prescribe that for her. And so she now has her birth control device. And the client's second issue was that she was very underweight. So, and had no appetite. So if you can imagine, that's a new mother who's underweight, has no appetite, and has a baby. So as part of care coordination, as part of our CCBHC, we have dietitians that work in our behavioral health locations. So we pulled in a dietitian, and she was following up with her as far as the diet. And additionally, our staff person saw, hey, this young mother needs to have connection with a family support coach, because we're able to provide that too. So we hooked her up with a family support coach, which now she can go to some parent cafes and be able to talk to other young mothers and parents who are going through kind of the same type of thing. So I think that just being able to link and refer all of that within our own, with the Care Connect and getting that to everybody, all of these are under our services, what we actually do. We had another one that she has on here. I'm not going to go through all of these, but this one was that we had an adult client who was undocumented and pregnant. And so she was unable to get me prenatal care because she's undocumented. And so that was very challenging. So they collaborated with the RN care coordinator, and we have child and family services. And in our child and family services, we have a group that's called Family Connects, which is a national organization that provides RNs at no cost to families before the baby's born and after the baby's born. So she got hooked up with the Family Connects nurses to be able to work with her on that. And so, I think those are some good outcomes. We also had one who had a very frustrated mother who was explaining to this nurse how much difficulty she was having with the care of her son, who has many medical issues. And she felt as if her PCP just dismissed her and didn't listen to her. So she expressed that she wanted her son to have palliative care at the Cook's Children's Hospital and not to necessarily be in this all-in care. And so what our staff did was help her switch to a PCP that actually would listen to her and hear what it was that she wanted and help figure out what she needed. And so now she is in that palliative care program.
Oh, that's great. I really love that example. The first one you shared, because it was around, these are all your different departments underneath in the county, correct?
Yeah.
And being able to use the tools, the interoperability tools we think about it, interoperability is I'm sharing data with external sources. This was an opportunity for you to coordinate the care across different county departments for this person. Right. That is powerful. So it kind of makes us think a little bit differently around interoperability. It's also internal to us as well. Mm-hmm. Fantastic. Great stories and hot off the presses as well. That's great. It just came in. Luis, I wanted to ask you a quick question, if I may. We talked a little bit about, Grace talked about kind of social determinants around transportation challenges when we were looking at the context around telehealth and being able to bridge that. So when we think about kind of social determinants, when we look at an intervention's personal health, how do you factor in kind of social determinants into a patient engagement strategy?
Sure. So I think over at Waukesha, we have really planned this out. We have our clinicians that are taking care of our clients utilize the problem list. So we understand that, social determinants of health are a factor in treating our clients. And so overall, we have trained our clinicians to add, unemployment, anything that may affect them socially, affect their clients socially to the problem list. And so as these clients are getting services, not only within our facility, we're able to, route them to the correct area to obtain additional services. And where we're transferring that care record to the next level of care, that information is also going over with them. So overall, it's providing even better care for our clients because, all that information impacts, wherever they're going.
I think that's an important point you just made. As we look at, there are data standards around social determinants of health. Looking at it from a SNOMED code or even a LOINC code on a result could be tied to an assessment for a person. But then also the importance of that data then traveling with them. And doing it in a way, and I think technology solutions are starting to catch up to where some of that social determinants of health information is kind of codified in a way that can be consumed by another system. I think we're kind of getting there, but the way you shared and articulated is really encouraging around, at least this is where you're going. This is how you're capturing this problems list and how am I making that information available to the next individual organization that is caring for that patient. So Grace, any thoughts from your perspective around social determinants of health as part of a patient engagement strategy?
I think we do like what Lewis was saying, and we have so many of the assessments and things that we do touch on that. But one of the things that we've been doing as well is we developed our own risk stratification tool in the EHR so that it has social determinants of health as part of it. And then it will go through and add up basically someone's score as far as what their risk might be so that we can, in the different areas, so we can determine what we need to do as far as treatment planning. We also use Care Manager within, which is another product that NetSmart has, so we can figure out what we're doing with our care coordination with the patients. And care coordination is a big deal because that is the way to do patient-centered care. And I think that's the way that we have patient engagement, is by not just, I mean, Luis was saying that earlier, not just entering something in an electronic health record and never looking at the patient, but actually looking at them and engaging with them while we're doing that, and then having people that also do those soft skills with the patient. And if they don't have transportation or they don't have food, it becomes that Maslow's hierarchy of needs that we've all heard about in school, that you're not going to want to go and get your behavioral health, because if you don't have food, that's a major thing. That's more important. So we have to be able to address those.
Yeah, I think that's a really important part. You know, when we look at the linkage and the correlation of social needs to behavioral health and physical health outcomes, they play a really important role. And talking about how to not only capture those needs inside the electronic health record, but also being able to pull that up a layer and looking at it as part of a broader care coordination and population health strategy, so that you can, whether you're setting your own risk scores, the data is necessary to be able to determine who's at an elevated risk, and then what's the appropriate intervention, so that I can then go and outreach and engage. And I like the way you said it. It really drives kind of a patient-centered care, where the patient's needs could be across many different domains of care, and having that in a centralized location with a care coordinator sitting on top that is acting as the kind of the QB for that person's whole care really helps us, I think, drive and bend that curve around cost, but ultimately on improving outcomes and a better quality of care and experience for the patient.
Because I think that, like my example that I gave earlier, the one with the first young lady, that,
yes.
I mean, that really is, all of that, it was really related to social determinants. I mean, if you go down to that, that's what it all boiled down to. And so it really did require that care coordinator to quarterback going through all those different places to help her get all the things covered that she needed.
Yeah, and I think you articulated it well, that it takes more than an EHR, but looking at kind of a broader care coordination platform that really has the person in the middle, but also the family members and support, which Luis also talked about, and you talked about in your example as well. And we really are driving towards making sure that we're delivering the right interventions at the right time, at the right person, even at the right cost when we're looking at CCBHC. And, you know, from our perspective, you know, we look at those building blocks of the timely appointments, the ease of access of information, and the good communication. The technology tools are there. We look at, you know, how can we leverage telemedicine and virtual care in order to create an access point for an individual to meet them where they're at, and remove as many of the barriers to access to care as possible through the use of technology. We also talked about the ease of access of information, whether we're talking about sharing that information from the provider to the patient using a patient engagement solution. Also looking at more on the monitoring side. Luis was talking a little bit about this, of how do I put together kind of a health status monitoring program so that I can have regular checkpoints with the patient outside of the scheduled appointment session in order to make sure that they're doing okay. And if they're not, we're able to identify that and have the appropriate targeted intervention so that we're not having an exacerbation of symptoms and maybe having someone go into the hospital. So how are we more proactive with that information, and then taking that data and driving it into a provider's workflow? So These are all really important. You talked about good communication and leveraging tools with hospitals and primary care. So there's a bi-directional share of communication and being able to have better visibility to an overall longitudinal view of a person and really helping drive transitions of care and care coordination. So really great conversation and dialogue, and Grace and Luis, really want to thank you for this, being able to share that with our friends here and members of NACo, the really great work that you guys are doing, and really hope that the audience, everyone listening, took away some pieces of information that were shared by Grace and Luis, and look to apply them inside of your county, maybe helping your patient engagement strategies as well. So Nastasia, I think I'm going to transition this back over to you to take us in for a landing.
Great. Thank you so much, AJ, Grace, Luis. Wonderful conversation, super interesting. Thank you, audience members, for your questions, and appreciate sort of the recap and some of the takeaways as well. We have been recording this. We're gonna post it on the NACo website. So if you want to share with your colleagues or refer back, and happy to, of course, share contact information for our speakers as well, if you all want to engage, and contact information for our folks at NetSmart. So thank you, everybody, again. Have a wonderful rest of your week. And this concludes our webinar.